Dear friends of Malta, this year the Rare Disease Day is celebrated on Saturday, 29 February, because that's a leap year. But you're starting today with this event. And the purpose of this video is really to support your effort and to praise your effort of all the community, the collective efforts in Malta. We have a long experience in working with Malta, as you know. We've been working so closely with the university already since the year 2000 on the Euro Biobank, the biobanking and the registries, but also together within the European Medicine Agency and in different contexts, including in supporting the creation of the National Alliance for Rare Diseases in Malta, which is developing so well thanks to your efforts. In 2017, it was the EU presidency of Malta, and together, thanks to the great support of Mrs. Michelle Muscat and of Mr. Chris Fern in the government and of Mrs. Daly from the Ministry of Social Affairs, we were able to organize a great conference on improving access to rare disease medicines. In parallel to that, Malta initiated the Valletta Declaration with 8 countries from the EU, from the south of Europe. And that's a fantastic commitment. We need that to translate into stronger reality. We need the member states to collaborate, not only the 8 countries, but also all the member states of the EU need to collaborate to improve access to medicines, to come together, to negotiate, but also to accelerate access, maybe to do some joint procurement. It makes sense when it is a very rare disease. Think of it. In Malta, each rare disease affects less than 50%. And at best, it's around 400 rare diseases, which affects between 50 or 1%. For all the other rare diseases, it's going to be once in a while that there is the rare disease affecting one of the family. So all of that is extremely rare. It doesn't make sense to stay alone. We have to work together for medicines, but also to gather expertise. That's why I also would like to praise your recent launch of the hub for the European Funds Network located in the hospital in Malta. That's a great step forward. And now with all the work that you're doing of information of physicians and pharmacists, this will improve the access to diagnostic and access to care for people in Malta. I also would like to praise the decision made by the Ministry of Social Affairs and the Assembly of providing parents of child affected with rare disease with the possibility to spend few years with their child and to be financially supported for this. I'd like also to mention that in 2017, when we organized together a workshop on rare diseases research, at that time there were 14 countries coming together to create the European Joint Program Co-Fund for Research on Rare Diseases. Thanks to your efforts, we've been able to launch it. The European Commission has launched it with the member states. And now, believe it or not, there is 35 countries involved in this program, which was launched last year. The last joint effort I'd like to mention was that Malta, as a country, was involved with us in the efforts at the United Nations. Together, you participated into an event that we had organized in 2017, but also last February 2009. Together, we called for the inclusion of rare disease into the Sustainable Development Goals of the United Nations, but also in particular into the UN Political Declaration for Universal Health Coverage. And we have been successful. On the 23rd of September 2019, the Political Declaration on Universal Health Coverage has been adopted. Rare disease are into it, and this will tremendously improve the access to care for people with rare disease around the world and to have more services covered and better percentage of coverage and reimbursement. So I'd like to really praise these efforts because Malta didn't do it for themselves. You're already more advanced. You did it for the world. You've been very generous. I thank you very much and I wish you an excellent event. Thank you.